So we're back in session again. So now we are doing a session number 4 on innovative models. And the program, as you probably have it, says that Nicole Marrone will do a presentation now on community health workers. Unfortunately, she have had to leave with the family emergency situation. So one of our former speakers, Theresa, is going to take care of that as well as she can. And the presentation will be posted afterwards, I have understood.
I haven't had a chance to even look at these slides, so I apologize ahead of time. But the reason that Dr. Marrone asked me to try to step in today when her family emergency made her have to leave very quickly and go back to Arizona, everything's going to be okay. Her dad was in a car accident and possibly had a stroke last night. He was on his way to take care of her 6-year-old because her husband's doing research at the South Pole right now. And her suitcase never got here on top of everything else. So please, I think that we really just need to give her a lot of credit for wanting to get a talk in today, given all of that. Dr. Marrone is at the University of Arizona, and I was very privileged to get to know her as a consultant for when she prepared a grant presentation. And these are her collaborators with the Arizona Prevention Research Center, the Department of Spanish and Portuguese, and the Mariposa Community Health Center. Her program and her research looks at community health care workers. And so first she wanted to talk to you about who they are, and then why they're so important, and how community health care workers can improve health and access to care. So community health care workers are the frontline public health workers. They're considered trusted members that serve the community. They serve as a liaison or a link between health and social services and various communities. And they facilitate individuals' access to services, and they improve quality and cultural competence of service delivery. They have many titles, as shown here, and the one that in Arizona is the one highlighted here. They are called, and I have no good Spanish. Does anyone speak Spanish here? Promotora de salud. The community health care workers do have core competencies. They have to have good communication skills, have interpersonal skills, etc. But the important one for us today is to know that they have to have a good knowledge base which they can share with the individuals about whatever health condition they are providing information about. Let's see. So the most important aspect of what community health workers do is provide that cultural mediation between communities and health and human service systems. They also advocate for individual and community needs and make sure that there's culturally appropriate health education and support available to the individuals. So what's distinctive about community health care workers? Well, they don't provide clinical care. They generally do not hold generally do not hold professional licenses. And Dr. Marrone's highlighted here is that a critically important part of what they do is have expertise about the community because they share the culture and the life experience with the population that they are serving, so that they can achieve certain results that other professionals cannot. For example, patients might not feel comfortable describing issues with their medication, so instead of doing anything about it, they just won't take it. But a different type of communication happens when promotores are there, and they can communicate back to the physicians, and so interventions can be done appropriately. Another important part of the promotores is that they relate to community members as peers rather than purely that doctor-patient or client-patient relationship. So previous research has shown that having community health care workers improves access to care. It's been used successfully for chronic disease prevention and management, and it's resulted in improved utilization of services, and it actually ends up reducing inappropriate use of emergency rooms. So it's great because it helps us to control costs, and there's a real good return on investment by having community health care workers. The research has shown that community health care workers have proven effectiveness in addressing health disparities for minority populations. As I said before, increasing healthcare utilization, providing culturally competent health education, and advocating for patients' needs. So Dr. Marrone said that when she first learned about the community health worker model, she had one of those life moments with high impact, thinking, wow, this could work to address a problem we have in audiology, reaching people in the community who are otherwise not seeking audiological services. And so to address this from an audiological standpoint, she had at the University of Arizona many years been doing a community-based oral rehabilitation program called Living Well with Hearing Loss. So if you combine that Living Well with Hearing Loss program with the community health worker intervention to improve access care, imagine the potential for improved outcomes in a different population. She included this slide to show that as much as we have the general population not accessing hearing health care, the percentage of Hispanic and Latinos accessing hearing health care is much less, estimated to be only at about 4% in this country. So she developed a community-based audiological rehabilitation model to identify untreated hearing loss in the Hispanic population. So far, 84 adults have been tested in the community, and 76% had hearing loss but had never had access to care. So they've placed these people into Spanish community-based AR groups. She also has a group of equal English community-based AR participants, and both groups showed improved outcomes in terms of enjoyment of life and daily use of communication strategies, even without the use of hearing aids. So she wanted also to highlight that the rationale for us seeking ways to reach underserved populations has to do with the diversity of the aging population in the United States and the growing prevalence of chronic health conditions amongst all aging populations, including hearing loss. We have an increased focus on prevention and wellness in healthcare, but we have a growingly complex healthcare system. Although we do know that social and behavioral determinants of health are important to examine, there is a lot of cost pressure on the system. So thus, another goal of Healthy People 2020 is a commitment to reduce health inequities across populations. In collaboration with community providers and community health workers, she's seeking to identify barriers and resources in the community and collaboratively develop an efficacious community health worker intervention in a community that is generally underserved and facing great health disparities. The local context for her research has to do with the fact that the University of Arizona has established a relationship with the Mariposa Community Health Center, and they've looked at the effectiveness of community health worker intervention and shown that it's been very effective in diabetes and cardiovascular health. So we know that audiology and hearing loss has connections to diabetes and cardiovascular health. So why not, she said, have the community health workers address hearing loss education and intervention, as well as diabetes and cardiovascular health. The social and economic demographics of the community in which the project will occur suggests that utilizing the community healthcare workers is very cost effective. So through her research, which is funded by NIH and IDCD, she's doing an R21, R33 project. The first part of the project, she's identifying barriers and facilitators of access to hearing health care in the rural, underserved population. After she identifies these barriers and facilitators, they're going to develop culturally and linguistically relevant materials And then in the second phase of the research project, test the effectiveness of the community health worker model of intervention for hearing loss. In terms of her future directions, she hopes to test the effectiveness in other geographic regions with underserved populations and further integrate other aspects of audiological services, and establish cost effectiveness of early intervention and develop new models of care that integrate community health workers. This is her group at the University of Arizona with whom she works. And she had a slide here, and I think that there's there's someone else in the audience doing something like this. And yes, and tell me your name because again, tell the group your name. And right. So in Massachusetts with the Community Health Worker Project, and she did mention in a slide that you were here and doing very similar work. So hopefully if there's questions later on, you may be able to address them. Thank you very much.
Good job. So now for something different. Teleaudiology by Gabriel Saunders, who is working at the VA Research Center in Portland. And I suppose it's something with IT and acting over a distance or something?
Yes, exactly.